Have you or anyone close to you caught COVID? If you know anyone who had, or if you had one of the most characteristic symptoms of this disease, loss of smell, you know what I am talking about. For many people, the recovery of the symptom may take a long time. Did you know that there are many degrees of loss of smell, and it can happen at any stage of COVID-19, or even not show? Different from what we see in other respiratory diseases, like rhinitis, sinusitis, and colds. The loss of smell in COVID-19 happens abruptly and intensely. However, according to the experts, it can be reversed with some steps. As the pandemic went on, doctors noticed that changes in the sense of smell and taste were frequent in patients with COVID-19. Luckily, most can spontaneously recover, complete or partially, in a few weeks or months. Although hyposmia, partial loss, and anosmia, total loss, are common in cases of respiratory infections, research from the Brazilian Association of Otolaryngology and Cervicfacial Surgery, ABORL-CCF in Portuguese, reveals that patients infected by the novel coronavirus face longer times of recovery. The suggested treatments act as a means of accelerating the recovery of their senses. Although unknown until now, olfactory training has no contraindications and helps accelerate the recovery of smell. Olfactory training consists in trying, twice a day for a few seconds, the 4 types of smell, in the form of essential oils of eucalyptus, lemon, roses, and clove. Alternatively, you can use coffee, clove, honey, red wine vinegar, mint toothpaste, vanilla essence, and concentrated tangerine juice. Isn't it nice? Enjoying the video? Then give it a like and share it with your friends to help the channel. The experts say that the patient should think about each smell and make an effort to actually smell them. Also, you need to be persistent since the results don't come quickly. Even if the patient can't smell anything on the first days, it is important to keep the training going. A damaged nerve has good chances of repair, and this training is the fastest way of making it happen. To recover your sense of taste, the training isn't that different. Try tasting foods with the 5 base flavors: sweet, savory, bitter, sour, and umami. Recent studies show that olfactory training improves the ability to identify smells. There are other possible treatments for loss of smell. It is necessary to be followed by an otolaryngologist, and medications may be prescribed for some cases, depending on the evaluation of the doctor. A Brazilian study shows that most cases of loss of smell improve, and only 5% don't show any improvements. Early treatment helps in the recovery of smell and must be done under medical orientation. Isn't it amazing? Try it and share your experiences with us. If you liked the video, give it a thumbs up and share it with your friends. For more recipes and tips, subscribe to the channel.